Welcome. Today we have with us Chad Hendry. He is a registered nurse here at Applegate HomeCare and Hospice, and he also has case management experience. And today we're going to be talking about patient discharge. So thanks for being with us, Chad.
You're welcome.
And yeah, I'm excited to pick your brain about this. So
Happy to share.
Perfect. So we'll just get right into it. First off, can you explain what discharge planning is and why it's important?
Discharge planning is an effort for a medical professional to assist a family member or a patient in a medical setting with resources to better thrive at home or an environment that can improve their life.
Who is typically involved in the discharge planning process?
Typically, first and foremost is the patient, of course, and the patient might have family members that assist with that planning. And they're certainly welcome and invited to be part of that. Of course, there's the medical team, professional team, whether that's the nurse or the doctor or therapy, some facet of medical care helps with that. And then, of course, you always involve the insurance because they have to approve it.
Totally. Yeah, no, that makes total sense. And then how does discharge planning differ between hospital, home health, and hospice care?
So when a patient is in a hospital, they're looking to discharge to another level of care. Usually that's home. And so home health and hospice are an end result of that discharge planning process. And so a hospital environment is in that moment of need, in that moment of care, and what's the patient going to do once they leave the hospital? Home health is in the home where the medical team comes and assists the patient. And then hospice, of course, helps with the comfort and quality of life. And that all needs pre-planning while a patient might be in a hospital setting, because we don't know how the patient's going to discharge from the hospital, what new medical issues or health issues they might have, or what environmental issues they might be facing. So they all support each other, but it's like a train. You start out maybe in a hospital setting or a clinic setting, and then you get to your home and you have these support services.
And then what are key factors considered when planning patients' discharge?
Key factors would include insurance, because we want in-network support, of course, and environment. So things like, where is the patient going to discharge to? What's their home like? Is it a multi-level home? Is it a one-level home? Is it an apartment complex? What kind of accessibility do they have? Other key factors might be transportation, support services. Is family involved? Do they live with family? Do they have a spouse, a caregiver? What kind of resources are needed to help this patient thrive for a healthy outcome?
Totally. What are some common concerns families have about discharge, and how do you address those concerns?
Depending on the patient, the age of that patient, some of the common concerns might be support. If it's a parent or a sibling, can I provide the time and effort to support this patient in their home, this loved one in their home? So family support is a common concern. Another one is mobility. Can this person get up to the bathroom? Can they eat and get to the kitchen? Can they get out of the house safely if there's an emergency? Who can help with these things and how often? And so, and understanding. Families have a great need to understand the process of care. And so they're educated through the home health team, through the hospice team, and even some preliminary education in a hospital setting. So the level of medical understanding is a factor that many caregivers worry about.
Totally. And then what kind of support and services are available to patients after they leave?
After a patient leaves a hospital, there's lots of community resources. And that's where a case manager can come in, either at the hospital level or the home health level, even the hospice level, and even in the clinic level. There's case managers, whether they be a nurse or a social worker, who can come in to the family or the patient, and through a series of assessing questions or an assessment, determine what kind of resources they can bring in to that patient. Sometimes it's medical equipment, sometimes it's medications, sometimes it is transportation and appointments with follow-up care. Sometimes it's some level of therapy. And of course, there's your standard concerns in the community, like utilities and heat and clothes and food, and many resources that a case manager can reach out to if needed to help with that family care.
Oh, that's awesome. That's great. How do you coordinate with follow-up care such as home health, physical therapy, or hospice?
So the primary caregiver of a patient is the physician, their family physician. The family physician is like the point of the umbrella, and then the umbrella itself is all the services that a patient might use for their health care. And so as a case manager, we coordinate back to the primary care physician. The home health agency works with the primary care physician. The hospice company generally has a hospice doctor, but they may refer to that primary care physician for follow-up, for questions. And so if a patient can have a primary care physician, or at least establish one, that's going to help their care plan go much smoother and much better.
And then what should families look for when choosing post-discharge care providers?
Families should first look at insurance. What does insurance cover? Does it cover home health? Does it cover skilled nursing facilities? How many days does it cover? If it's Medicare, there's a pretty distinct recommendation for coverage, but there's several Medicare Advantage plans that can also affect a patient's type of care or for how long. So insurance is a good one to understand some basic elements of care. Another thing they should look for is where this patient's coming to, or where they came from. Are they going back to their apartment? Mm-hmm. They should look at the support, okay? A lot of times a patient might come to the family and need daily support from family, but family's not around daily. Mm-hmm. So then there's a family meeting and discussion. Another one is medications. Are there new medications on board, whether they be IV medications or oral medications to treat the new symptom or disease? So those are some key factors: insurance, environment, mobility, support, that will help make that adjustment that families should be prepared for.
Yeah, I like that. I feel like, just focusing on insurance first, because it can get expensive if it doesn't work out that way.
It can get expensive, and sometimes a patient might choose a plan of care, but then it's not supported by the skilled nursing facility. And so all of a sudden that patient now has to travel 30 miles away to go to a skilled nursing facility, and that affects spouses and family. Or it might include a copay, or it might include equipment that's not covered by the insurance. And so this can heap up expenses to the patient.
Yeah.
So that's something important to be aware of. And case managers don't know those answers, but the insurance has a member services number that you can call and talk to.
Oh, that's awesome.
So yeah, that's an important part of peace of mind, right?
Yeah.
If we have peace of mind, we're going to recover better. We're going to participate in our health care, and we're going to look forward to improving rather than being discouraged because we're going to get a big bill now.
Yeah. No, totally. And how does effective discharge planning improve patient outcomes?
Peace of mind is what I refer to.
Yeah.
If I'm a patient and I'm going home and I know that I'm going to have a caregiver there to help me get to the bathroom or help provide food, I'm going to make a greater effort to participate in my recovery. Or if I have a doctor that I can call upon, or the family can call upon, or the agency can call upon, I know I have a resource to ask questions. If I understand the plan of care for home health or hospice or therapy of some sort, I know there's a plan in place. So I know what I'm going to do every day for the next little while and how to measure my recovery. That's going to give me peace of mind so that I can focus on recovery.
Totally. And just kind of just thinking about that, like, how can one, I guess, go from like one level of discharge planning to that next level of discharge planning where it's all set up? Like, is there like any recommendations you have with that, or is that more on the loved one to kind of plan out, or how does that usually go about?
So a lot of situations in a hospital are planned
Okay.
surgeries, maybe planned admissions. And so there's a case manager that can help with the next step of care once that discharge is met. But there are those that come through the emergency room and now they're in the hospital. And what are we going to do now? Because my physical circumstances changed. I'm no longer walking 50 feet. I can't make my meal and I need help to the bathroom. So it's I encourage families to have a pre-plan, especially when they're dealing with elderly parents or elderly siblings or handicapped children. What is the backup plan for various circumstances? If my dad lives alone and falls and can no longer live alone anymore, but wants to go home, what is the plan? Is it family moving in? Or has it become now an emergency for the family? And so my recommendation as a case manager is that the family have some lively discussions with people who have in their families who have health conditions to just talk about discharge planning given a circumstance.
Love that. That's awesome. And then the final question here is, what's one thing you wish more people knew about discharge planning?
That there is a resource to talk to. There is a care manager to talk to, whether you're in the hospital setting, whether you're in the home health setting, whether you're in the hospice setting, whether you're just a good patient in the clinic setting and you're healthy. There is a care manager you can talk to about resources. Oftentimes families don't know where to go next in a healthcare crisis.
Totally.
And so the caregivers become frustrated, and that creates contention with the patient or with other family members. So if they knew that there was a case manager that could come and help them find solutions for their next level of care, that's the first question to ask.
I love that. That's awesome. Well, sweet. Thank you so much for your time, Chad.
You're welcome. Thank you for asking.